Hi everyone, Courtney asked if I would share some of my experience in the road to licensure for genetic counselors in Connecticut. I'm really happy to do that. This process began about 10 years ago. So we started to think about licensing in the state of Connecticut because other states had begun to license genetic counselors. In 2008, there were about 11 states that had licensing and about 9 or 10 that were in the process of trying to do that. And it was a really, I think national goal to have all genetic counselors be licensed. One of the initial states that was licensed was California, and because of that, and there's so many genetic counselors in California, about 1/3 of genetic counselors were licensed by that time. So when we had the opportunity to think about this, we wanted to think about it from the perspective of the state, the perspective of the practitioner, and very importantly, the perspective of the consumer. So any health profession that's licensed serves as the protection of the public health, safety, and welfare, because individuals have certain standards in order to become a licensed professional. And there were over 60 health professionals that had licensure in the state of Connecticut. Licensure recognizes professional status, demonstrates the accomplishment of recognized set of educational standards, and continuing commitment to high standards and continuing education. So our perspective was that if an individual reached the qualifications because of their education, so a master's in a board accredited genetic counseling program, and they sat for the boards and were certified, that would be accomplishment and standards that would be associated with qualifications for licensure. We did not want to add additional professional responsibilities because the national landscape is very, very consistent. So we didn't want to be an outlier, and we certainly weren't going to be able to have lesser qualifications than the certification requirements. So the perspective of the consumer became more and more apparent as the availability of genetic testing exploded. Tests were also advertised, sold directly to consumers, and some of the elements of pretest counseling and informed consent were somewhat on shaky ground. So checking off a test box and sending a blood sample or saliva sample in didn't seem to many of us enough so that people would really understand the possible implications of genetic testing. The American College of Medical Genetics in 2008 recommended pretest counseling to ensure appropriate informed consent, result interpretation, follow-up care, and clearly a guiding principle for genetic counselors is always that the individual has really had a chance to explore the expectations of how the test can be helpful for them or their family members and what the possible test results might be. So as I mentioned, the process began in 2008 and required a lot of persistence, perseverance, and a tremendous commitment. So if you knock long enough and loud enough at the gate, you're sure to wake up somebody. So the person that I chose to wake up was my state senator, who I knew through other local activities, and we met. Ginger Nichols and I met with her, and she was very, very interested, but she decided that at that point, because of the committee that she was on, it wouldn't be the most appropriate for her to begin working on this. So she introduced us to another legislator who at that time expressed interest, but we didn't really get any traction. And as we did that, we engaged genetic counselors in the state and formed an ad hoc committee. We organized an initial meeting in October 2008 to discuss the pros and cons of licensure, thinking we'd kind of go back in 2009 to the legislature, and we did an email survey among genetic counselors in Connecticut. This was kind of before the days that monkey survey was that popular, but we got it done through email, and supported the support of licensure was almost unanimous. So the major reason that I was interested in licensure was to afford consumers protection. There were many patients who came in to see us who thought they'd had genetic counseling by someone in their physician's office, for example. And at the time, we really had a explosion of testing for inherited cancer, and one of the laboratories that was doing the testing for BRCA1 and BRCA2 decided to launch a advertising campaign directly to the consumer in the Northeast. And that had been done about 6 years ago in the Mid-Atlantic region, and showed that many more people got genetic testing, but not necessarily the most appropriate people who were at the highest risk underwent genetic testing. And we really noticed that people would tell us that they'd seen the genetic counselor in their doctor's office, but clearly they hadn't seen a genetic counselor because all these doctor's offices didn't have genetic counselors, but they had undergone genetic testing. So genetic counseling licensure would afford title protection to allow individuals who only qualified for the title to be those individuals who had gone through the appropriate training. And it would actually be against the law for other individuals to designate or imply that they were genetic counselors, even if they might either from time to time or very consistently coordinate genetic testing. So we obtained a lot of information about the reasons that we thought genetic counselors should be licensed. And it was a really great process of educating many people about who genetic counselors were, where they worked, what they actually did, how they did it, who were the consumers, and people wanted to know who the stakeholders were, who would support us, who would be against us, were there any hot button, really big red flag items that would make people push back. And we thought about that and met with the health commissioner and a number of people in the legislature, and we were informed that in 2011 the Connecticut Department of Public Health instituted a scope for practice review process. So that was like this big curtain that kind of fell over my brain at that time. I was thinking, wait a minute, like we can't do it the way we thought we were going to do it. So we had to kind of regroup, not necessarily institute a bill because we really wanted the Department of Public Health to be supportive and not push back. And so although we had legislators who were willing to raise a bill, we kind of decided to kind of go the middle ground. And we prepared a scope for practice review that we submitted in 2012. And so how this goes is that you submit it in the summer. So this was kind of in 2011, we found out about the review. We missed applying for it, so we promised that we would submit it in 2012. So as soon as it was available, we worked on what was essentially a questionnaire that asked us about our profession, what we did, where we did it. Again, same questions. What we did, where we did it, who were the consumers, who were the people we worked with who might have an idea about whether licensure was good or bad. Would it change? Another question was, would this change access? So if genetic counselors were licensed, they didn't want this to be a barrier to people getting services. We actually felt that it was not going to be a barrier. It would increase accessibility. In addition, they wanted to know what our training was, and we were very careful and methodical in explaining how genetic counselors were trained, and very detailed about these certification examinations, because again, we didn't want to burden our profession with extra regulation. So we submitted in 2012, 13, 13, 14, and then 14, 15. And we kept submitting, and we kept getting bumped up a little bit higher on the list. So there might be 10 or 12 requests. I think one year there were 5, and we had to be picked. So we were selected for review in 2014, 15. And I remember somebody in another seat saying, "Why did it take you so long?" Well, it wasn't a mistake. It was just simply the best we could do under the circumstances. The real mistake was to not try. So we were invited. I was actually invited to be on the committee to review the scope of practice. And so in this context, we had to have permission from our administrators, from our institution. I also worked really, really closely with the legislative liaison for our institution and kept her informed every step of the way. She was really a huge help, very, very supportive, and very helpful in explaining some issues of the legislative process that I was not as familiar with. There are other representatives from the Connecticut Hospital Association and the Connecticut Radiological Society, and they were invited to be on the committee because the scope of practice selection then also required other commissions or other interest groups to submit a letter, if they wished, about the scope of practice. And so, if you sent in a 2-sentence letter that said, "I'm really interested in genetic counselor licensure and I'm from the society," they invited you to be part of this process. And interestingly enough, just CHA and the Connecticut Radiologist Society submitted something. Meetings were held over a 3-month time period, and the final report that evaluated all of the questions in terms of professional status was written by the commissioner. So then we went back to the Capitol. As this report was being written, we simultaneously wrote a grant to the National Society of Genetic Counselors to obtain funding to hire a lobbyist. We interviewed lobbyists in December 2014, and we really were excited when we received the grant, hired the lobbyist we chose, and worked to make the bill. And so the genetic counselors, Linda Steinmark and I, researched and wrote many fact sheets. We had them reviewed by many of our colleagues. They addressed our practice, but as these things work, the bill passed as part of the budget implementer in June 2015, and licensing began in October 1st, 2015. I was actually the first person to get a license in the state of Connecticut, so that was really, really exciting. So here it is under the Connecticut General Statutes, Chapter 383D, Genetic Counselors, and it discusses the definition, somebody who's been licensed under the provisions of all this, and that the law says that no person may practice genetic counseling unless licensed or permitted based on the other qualifications. So here it is on our website. And now, as of November 20, 2017, so the next step is credentialing at the institution that you work at, which often involves professional staff membership. Despite our licensure and scope for practice review, our institutions wanted a review of the scope of the profession, and then recognition of status of professional services by the Center for Medicaid and Medicare Services, which will really be the key to additional recognition. Courtney asked me to mention, many of you don't live in Connecticut or Massachusetts where there is licensure. What can you do? And I suggest you go to your Department of Public Health website, look at what it takes to become licensed. I know in New York, the process is working towards trying to get legislation. And that's a much bigger state with a lot more genetic